Is nursing school hard? Many people considering a career in nursing ask this question. The answer is yes. Nursing school is challenging, but it is also incredibly rewarding. Nursing demands a unique blend of knowledge, skill, and compassion. Future nurses must learn to think critically and act quickly in demanding situations. Nursing school prepares you for these challenges. It equips you with the tools and experience needed to provide safe and effective patient care. The journey through nursing school is demanding, but it is also transformative. It is a journey of personal and professional growth. The nursing school curriculum is designed to be comprehensive. It covers a wide range of subjects essential for nursing practice. The curriculum typically includes a mix of theoretical coursework and practical clinical experiences. Students gain a strong foundation in the biological sciences, pharmacology, and nursing theory. Coursework progresses to more specialized areas like medical surgical nursing, pediatric nursing, and mental health nursing. Throughout their studies, students develop critical thinking skills, clinical judgment, and ethical decision-making abilities. The curriculum is demanding, requiring dedication and a commitment to lifelong learning. Nursing coursework goes beyond memorization. It requires a deep understanding of complex concepts. Students learn about anatomy and physiology, disease processes, and medication administration. They study nursing theories and models, applying these frameworks to real-life patient care scenarios. Critical thinking skills are paramount in nursing. Nurses must be able to assess patients, analyze data, and make sound clinical judgments. They must think critically to solve problems, prioritize care, and advocate for their patients. The ability to think critically is essential for safe and effective nursing practice. Nursing school is not just about books and lectures. It involves extensive hands-on learning in labs and clinical rotations. In simulation labs, students practice essential nursing skills in a safe and controlled environment. They learn how to insert IVs, administer medications, and provide wound care. Clinical rotations provide real-world experience in various healthcare settings. Students work alongside experienced nurses, caring for patients under their supervision. They apply their knowledge and skills in diverse areas like hospitals, clinics, and community health centers. Before graduating, nursing students must pass a nursing exit exam and the NCLEX RN exam to become licensed registered nurses. These exams test their knowledge, critical thinking skills, and ability to apply nursing principles in practice. Nursing school is challenging, but it's also incredibly rewarding. It's a journey that transforms individuals into competent and compassionate healthcare professionals. So do you think you have what it takes to be a nurse? Leave a comment below.